Okay, so let's talk about gabapentin. So where did it come from? What is it for? You know, usually gabapentin it's been around since about 2004. What I've seen with gabapentin, it's really prescribed a lot in the treatment setting. A lot of people, they come into treatment, and some of the purposes of gabapentin is it's an anti-seizure medication, but also it can be used for anxiety. So often when I would be working in a treatment setting, I'd see a lot of people have been prescribed gabapentin, sometimes Depakote, both for anti-seizure medications. Sometimes they were actually prescribed to people for any kind of anxiety disorder too, alongside other drugs. If used as prescribed, then the client usually was doing fine on gabapentin. What I did start to see was gabapentin be abused. So sometimes, obviously, when somebody's in a treatment setting and their medications are controlled and they know how much the people are getting, that's one thing. But when people would step down and their medications would be in their own hands, people started to abuse gabapentin. So they would take them in higher, larger dosages. Often when people are in sober livings and they have a gabapentin in their hands, if they can't get their hands on other stuff because it doesn't show up in a drug test, gabapentin will be abused. There are a lot of people that do abuse it because they can't do other drugs during the time that they are being monitored, but afterwards it can definitely lead to other extensive addictions. Its molecular structure bears resemblance to GABA neurotransmitter. What does gabapentin feel like? Sometimes it can give you calmness, relaxation, and even euphoric effects. Gabapentin is both physically and mentally addictive. It's rare to experience withdrawal symptoms from gabapentin, but it can happen. Gabapentin is not commonly abused with other drugs. Gabapentin gets abused usually when people can't get other drugs. If you'd like to learn more about prescription drug abuse, click here.